Hi, my name's Steven. In the medical field, patient teaching is an important tool to help keep your patient properly informed and prepared to appropriately treat themselves outside of the hospital setting. In the following scenario, we will observe a post-op abdominal surgery patient being instructed by the nurse as to proper use of a spirometer, a common tool used in rehabilitation of the lungs, along with other breathing exercises.
Hello, good morning. My name's John. I'm going to be your nurse today.
Okay, hi John.
Now, could I please get your name and date of birth?
My name is Tyrone Biggums. I was born April 20th, 1969.
You go ahead and read that off of your ID band. All right, so you got the right person.
Okay.
That's great. Now, are you feeling any pain right now?
Well, I'm not feeling really any pain right now. I just feel like a mild discomfort in my chest whenever I breathe.
So breathing. So you'd say it'd be a breathing issue, right?
Yeah, like whenever I would be breathing in, like whenever I'd be inhaling, like I would feel like a little bit of a tightness, kind of like a corset wrapped around me.
So it's not squeezing, it's just a tightness.
Yeah, it's a tightness, yes.
All right, on a scale of 0 to 10, what would you rate this pain?
I would have to rate it like a 5, but it doesn't really bother me very much. I'd rate it a 5.
Right. It definitely is concerning that it goes with breathing. Let me go ahead and check the doctor's orders and see if there's anything for that.
Okay.
Now, I see the doctor wants me to assess your lungs post-op.
Okay.
Has any of the nurses assessed your lungs?
There was one nurse that wanted to come in, but I turned her away because I felt like I didn't really need to get taught that. I'm an athletic swimmer after all. What's so hard about breathing?
Right. Well, I sure there's more to it. The doctor has asked me to teach you some breathing exercises and introduce you to a spirometer.
No, I don't think I need it. Like I said, I'm an athletic swimmer. You know what? My lungs can just heal by themselves.
As you can see, Tyrone is not compliant with Nurse John or the doctor's plan of recovery. In this situation, how would Nurse John teach the non-compliant patient? Let's see.
And I see you're vaping right now.
Yeah, I own a vape. I don't really do it very much. I just do it whenever I'm stressed. I thought it would be a better alternative to smoking because I used to be a smoker before I became an athletic swimmer.
All right.
Wait, what's wrong?
Well, unfortunately, while you're recovering, your lungs remain idle, and now you're adding nicotine to that.
What does it mean by idle? I'm already just sitting down here.
Yes, and with that, your lungs are being used to that, and they shrivel as we speak. It happens very fast.
How fast are we talking about?
There's no exactly calculation for it, but if this continues, it will easily fill up with mucus. You'll catch pneumonia. It could lead to lung failure, and you losing lung capacity to the point where you can't swim.
That sounds pretty bad. That sounds really bad. Okay, I think I would like to listen to what you have to offer me.
Well, I'm glad you asked that. Now let me introduce you to the spirometer.
See how Nurse John convinced Tyrone in his non-compliance? He did not necessarily threaten Tyrone, but instead told him what would happen if he didn't follow through with the regimen that his doctor prescribed. Now Nurse John will teach him how to use the incentive spirometer along with other breathing techniques.
All right. Here will be your incentive spirometer. If you could go ahead and open it, and we start with assembly.
This is a weird little thing, ain't it?
Oh yeah, it's a quite strange contraption.
Can you tell me which parts go where?
I'll be alright happy to. That will be the mouthpiece. You inhale into that, and this will be the tube.
Okay.
Now this tube extends, and it also attaches to this port with the round end.
Okay, so I just put it in here, right?
Right in there. Now if you could hold that up.
Okay. Now, how do I hold this properly? Because I think it'll just fall out of my hands.
That's perfect. What I want you to do is hold the base first with one hand,
Okay.
and with another hand, grab onto
This handle.
the handle. Correct.
Okay.
Now, let me introduce you to the parts and pieces. First, we will start with the marker. The doctor asks for you to start at 500, and over time we'll move up to about 1,000 to 1,500 possibly.
Okay. So 500 is the starting point that I need to get to.
Yes,
while
sir.
in recovery. Okay.
Yes. And this will be the piston. You use the bottom of this piston right here to read to 500.
Okay.
And lastly, this is your indicator to how much force you're given. You don't want to be up here, and this means nothing. So what you want to do is try your best to stay between the arrows, right here.
Okay. And all I have to do is just breathe in, right?
Yes, sir. There you go.
Do you want me to do it again?
That's perfect. I want you to do it again. Yes.
Want me to do it one more time?
Yes, and one more time.
Okay.
Perfect. You being a swimmer, you may have already a higher lung capacity than what people start off with. But right now we will do our best with 500.
I think I can do more than that. Do you think I can? Do you think I should do that?
No, you don't have to.
Okay. Okay. So, what else was I gonna ask you, Nurse John? Oh yeah, I was gonna ask you, what other breathing exercises do you have planned for me? I'm a very busy person, first and foremost. I basically go around the country coaching swim teams for the Olympics. I also go overseas to help coach teams for the Olympics as well. So what if I forget one of these?
That's perfect that you asked. We got plenty of other exercises to teach you. 2 more, to be precise, that are very important. Right now, there's a mucus buildup. Mucus going to build up during here and while you're off traveling. So if I could borrow this pillow for a second real quick and place it on your stomach. Now if you could
Okay.
push it against, apply some pressure. I would like you to cough. One more time. And another time. You may feel some mucus come out. This would be build up inside your lungs. This would be very bad in this situation, and what you would want to do is remove it. Doing that every once in a while would be perfect.
Okay. I have another question.
Yes.
How many times do I have to do this incentive spirometer? How many times do I have to do it?
Now orders may vary, but our orders say 3 times a day, and you give it 5 minutes during these 3 times.
Okay. But what if... So I give 5 minutes, 3 times 5 minutes a day. So, what do I have... Can I do it like right now? Let's say like I'm at home, I'm just sitting there, and I just forget to do it.
What you want to do is try and space them out. If you can, you could have someone else remind you. You can also have other reminders such as a sticky note or a phone alarm.
Okay. Phone alarm, sticky notes, someone else to remind me. I can also do it during meals, right?
Before and after meals, during instead of vaping, you could do it while being idle.
Okay,
Yes.
that makes sense. But also another thing I would like to ask you is that I know there's the splinting that'll help keep these stitches in my abdominal area intact, so I don't breathe, so I don't like dehiss them,
Yes.
right? Okay, that makes sense. But what if but once those stitches are all healed, how do I get back to normal working volume, normal working lung capacity?
There's other exercises I can teach you. One will be pursed lip breathing.
Okay.
What I want you to do is put some pressure on your abdomen. Now, purse your lips. Now, in your nose, I want you to inhale for 2 seconds. Now, exhale it out your mouth. And one more time. And one more time. That is perfect. Now, I'm hoping you're able to add this into your daily living activities.
I think I would be able to add it in my daily living activities. I mean, this doesn't seem very hard to do, first and foremost. All I just need to do is just remember when to do it. That's it.
Notice how Nurse John uses the teach-back method with his patient. The teach-back method is essential for patients who are non-compliant.
Okay, so I think we're all set here.
We are, yes. Now, you're agreeing that you will be able to try and add this 3 times throughout the day, correct?
Yes, sir.
We get 5 minutes.
Yes, sir.
I will go ahead and document it. Thank you for meeting. I'll be able to set this up.
All right. The interaction is now complete. With the use of proper teaching methods, Nurse John has expressed his and the physician's expectations to the patient. Now it's in Tyrone's hands to make sure that he continues with these techniques on his own at home.